And back again with us today, Dr. Amanda Novak of Baptist Health joining us with the very latest on the front lines. I know you have been very busy. Dr. Novak, thank you for taking time for us today. We want to begin with at-home testing. A big topic today as Governor Hutchinson announced free at-home tests are available starting today. How accurate are these tests people will be able to get at home?
I would say they are a pretty good tool. They are not the gold standard. They are not PCR tests, but you know, they're pretty accurate. They might be slightly less sensitive with Omicron than some of the other variants. But what we know is generally if it's positive, it's a true positive. And you know, you can have some reassurance with a negative. A negative doesn't mean you definitely don't have it, but a lot of the times you're kind of playing the odds. So I would think of it as a tool, you know, and if someone in your home has COVID and now you feel sick, you know, it's one part of that. A negative doesn't mean you're off the hook, but it's helpful information. It really is.
And at what point, if you get a negative and you have symptoms, you've been exposed, do you think you might have COVID, but you're getting a negative on an at-home test? Do you suggest going in to get the PCR maybe at a drive-thru?
Yeah, so I think the big thing really with any diagnostic test is you don't want to do it if it's not going to make any difference in the way that you're behaving. So if you're committed to being home for the next 10 days anyway because of other things going on and you're going to treat yourself the same way, then it's less important that you go out and really get that accurate test. The flip side is if you have symptoms and you're trying to continue to do your job or be around other vulnerable people, that's when you really want to make sure that you have that gold standard to know your status.
And we have seen active cases double in the past week. Do you expect this to continue to grow? Could we see another double next week?
Yeah, you know, I've been looking at charts from all over the world, really, and they all kind of look the same. They have this very, very sharp spike toward the current time, and South Africa is already seeing the downward slope of that, but really everywhere else is still on the upward climb. We know at some point this will start to slow down, but we're not seeing any indications in the curve that we're there yet. And so I expect this to continue to rise really sharply for probably the next week or two at least, and then I really hope we start to see some relief after that.
We can only hope. I know you at Baptist, you are all very busy. Record drive-through testing numbers last week. Are you seeing the same this week?
Yes, we really are. And in fact, we're on course to break last week's records with this week's test. And so we are still seeing really high volumes and have started to, you know, really run into some mild issues where before we could really kind of promise 12-hour turnaround time, we're starting to get into that 24, 48-hour time and just really pushing the limits of what our lab can handle, what our staff can handle, and just the physical space to get people through that area to get them tested.
I know you all are working tirelessly. We appreciate you. Send our kudos and love to everyone there, and hopefully can get some rest soon. Dr. Amanda Novak, thank you again.
Thank you.